And we have with us here in studio Dr. Philip Muthoka. Is a member of the Coronavirus Task Force and a coordinator at the Ministry of Health in the Respiratory Pathogen Surveillance. Dr. Muthoka, thank you for joining us together with Dr. Lois Ombajo. But Dr. let me start with you. You've heard what he has to say. Let me begin with a reaction. Dr. Muthoka, go ahead.
Oh, thanks a lot for inviting us to talk about this coronavirus in the world. As a task force in Kenya, as a government, we have put in place structures to actually detect and early respond to any cases of coronavirus infestations in this country. The task force was constituted in January this year, and it was constituted because of the problem which is happening in Wuhan. And the task force is constituted of various subcommittees, which include coordination, case management, surveillance, laboratory, risk communication.
Okay.
And we are ready to take care of any case which comes into our country. So far, we have got 7 suspected cases so far. When we get a case at the airport or at any points of entry, we screen them, we interrogate them further on to where they have come from in China, where they may have come in contact with any persons who have been infected, or being into institutions where persons infected with coronavirus have been taken care of. When we find that is positive, then we take the initiative of isolating those suspects at our Kenyatta National Hospital Isolation Unit, where we take the samples, and I'm very indeed pleased to report that when we get any cases now, we are able to test and conclusively get to know whether it is coronavirus or another virus.
And I want to interrupt you at that point, Dr. Thank you. You've given us a good background of what the task force has done so far and the numbers in terms of suspected cases. We still have Jeffrey on the line. He's actually listening in from Wuhan. You've heard some of the concerns that he says, is happening to most Kenyans who are in Wuhan. I want you to speak to him directly. How can they reach out to the task force? How can they get that assistance? They say they haven't heard from you, Dr.
Maybe for Jeff's concern, I could tell him we empathize with him. We are very concerned about what is happening to students who are in Wuhan from Kenya. And we are with them, and we believe our embassy in China is going to consider assisting them in any way they may deem appropriate. But on the issue of evacuating...
Yes, which is what many of them are asking for.
Exactly. Evacuate like other countries. The government of Kenya has not taken a stand on evacuating. We believe it is better to manage an infectious problem at the point where it has been identified, rather than pass it over to another country where you are actually exposing innocent people to that problem.
Dr. He's listening to you, and he's not convinced, but you keep talking. I just want to bring that to your attention.
We are not saying we believe all students who are in Wuhan from Kenya are infected, but there's a chance, there's a possibility. So it's better they are managed in Wuhan than coming to Kenya, where there's a possibility of transmitting the infection to the rest of the people in Kenya. Okay,
I want to add the voice of Dr. Lois Ombajo to this conversation. Dr. I want to go straight to it. Evacuation. You can hear what Jeffrey is saying. Get us out of here. We're seeing what's happening with so many other countries, and we're wondering why our government still insists we should remain. Your thoughts as a scientist with an infectious disease specialist and a senior lecturer at UN.
Thank you very much for having me on the show. And to Jeffrey and the other Kenyans, our hearts really go out to you. It must be a very difficult situation at this point. I think the questions around evacuation, I don't speak from the perspective of the ministry. This is really just my opinion, is that one, for a country to be able to evacuate, there's certain plans that have to be put in place. We have to know where they will be placed, how they will be taken care of in terms of meals, where they will sleep, the medical personnel that will take care of them for that period of evacuation. So I'm sure some of the things that the task force will be thinking about as they go on is how exactly will this be done? Who will go and get these Kenyans back? And once they come back, where will they be taken care of for the period of 14 days until the period that's deemed to be infectious is actually over?
What's your recommendation? I know you've given us scenarios, but what's your gut feeling right now as you sit here, as you listen to what Jeffrey has to say, and with your experience in this field?
So my gut feeling as a clinician who's actually been in the front line with some of the patients who come in is at this point, I'm not sure we have a facility where these people can be taken care
within the country.
Within the country. And I think it's important, and maybe it's one of the things that the government is looking at how can they prepare such a facility. We think of it with compassion as well, because these are fellow Kenyans who need help and who are suffering. And as they see other people being brought back to their homes, the question of how can we get them here? And I think the best process would be to set up a facility that can take care of these people. And once that is available, then there'll be room for evacuation. As it is, if that facility is not ready, then the question of where do you take care of them? Is there a risk of transmission to the rest of the Kenyans? Will still be lingering in our minds.
Okay, we still have Jeffrey on the line. Jeffrey, you can hear that. You've heard from Dr. Muthoka and Dr. Ombajo. Your reaction?
I actually understand what they are saying, but the question that we have is how long is that going to take? We are already in week 5 of the lockdown. Dr. said that the task force was set up in January, where February is about to end. And I can actually speak on behalf of the other Kenyans also who are here. And the weight is something that you cannot believe. The mental drain that comes with it. And there's no Kenyan who's infected. And we have been under lockdown for five weeks. That's almost 35 days. And the incubation period is 14 days. Meaning, right now, there's no Kenyan who's infected by the virus. But then let me tell the task force that at the end of this lockdown, you're going to be dealing with even a more critical situation by trying to find a way of actually bringing mental calm and peace to the 100 students who are in Wuhan. Yet you could have found a way of sorting that out way earlier.
Okay, that's dealing a very strong point.
Yes.
Okay, let me allow Dr. Muthoka to come in as well. And Dr. Muthoka, of course, some concerns that whereas across the world, America, Europe, parts of Asia, we've seen citizens being evacuated. It's only sub-Saharan Africa where many of the countries are saying let the students stay and receive support, while still in China. And there are suspicions arising that is it fear that our countries, that sub-Saharan countries do not have the facilities to handle a coronavirus outbreak? Others are saying, is it because of possible, business connections as well? Just help dispel some of those myths that are spreading out there, Dr.
Oh, great. It is not because we are not able to manage a case of coronavirus, but it is because of the diversity and the spread of our country and the intermingling of our population. Immediately we get a case in this country. You remember like in 2009 when we got H1N1, which started like swine flu. It was reported in Kisumu in the end of July. By September, it was all over Kenya. And thank God it was not as severe as the coronavirus has been reported in China. So as my colleague has said, it would be good first to put in place structures where we can quarantine these persons who are coming from Wuhan and ensure we have adequate supplies and manpower to be able to manage them before we evacuate them. Even America, before they evacuated their citizens from the cruise ship, they had to prepare. And that's the award.
Are you preparing? Can you say that?
We are preparing.
Definitely. Is there a location you've identified, etc.?
At least we are prepared, at least for the isolation for any cases which will come.
Okay.
And now we are thinking about a quarantine facility where it can be managed by the government.
Okay. Dr. Ombajo, believe it or not, our time is almost up. Tell me this, what are practical things Kenyans should know now about how to prevent the possibility of catching the coronavirus? We are seeing a lot of myths out there, things being circulated on WhatsApp, but what are practical steps that a Kenyan watching at home right now can take just to make sure they, quote unquote, stay as far away from the virus as they can?
Okay, so part of it is being aware. It's good to be aware of what's going on, aware of what's around you. So at this point, what we know that without direct, what we call epidemiologic contact, without direct contact with someone who's from either Wuhan or with someone who has had the coronavirus, then the risk is particularly low. But having said that, there are certain general hygiene measures that everyone should adhere to. Basic things like frequent hand washing, coughing into your elbow or into tissue that you discard. If you're sick, don't go out into, public gatherings, or you could potentially spread the risk to other people. If yourself or someone has traveled, then it's good to declare that. And ideally, what should happen is if someone has traveled and you're not sure about potential contact, but you don't have symptoms, then at this point, you're advising that that person stays home, sort of a self-quarantine, for example.
Okay.
So that, you reduce the risk to other people. So a lot of this is basic hygiene measures that all of us should adhere to.
Okay. I have a question that I must ask my panelists, but I do need to take that break. So we take a short break. Here on Newsnight, we come back, we get one round of questions and then more news as well. So stay tuned. Coronavirus, what are your questions? 22422 is the SMS line and the hashtag is Newsnight. Send in your questions and I'll try and get some answers here after the break. Welcome back to Newsnight. We continue to talk about the coronavirus outbreak. Has Kenya done enough to prevent a possible outbreak or to deal with one should it happen? That's what we're talking about right now. 22422 is the SMS line. The hashtag is Newsnight. My guests continue to stay with me live from Wuhan, Hubei province in China. We still have Jeffrey Okundi, and here with me in studio, Dr. Philip Muthoka. He's a member of the Coronavirus Task Force, and also Dr. Lois Ombajo, who's an infectious disease specialist. Jeffrey, I want to begin with you on this short part of the interview. You've heard what the two doctors have had to say again, as we continue to ask them questions. Any final reaction from you? And also, at this time, is there any sort of immediate need you could talk about on behalf of maybe yourself or some of the other students? Anything that is needed right now as you wait to hear on sort of an evacuation plan or anything of the like?
Yes, thank you, Mwahiga. As they're working on and I believe, in all honesty, and things will not change tomorrow, like what happened during the first time they talked about evacuation. The immediate need that we need is that we need the basic necessities to be provided. There are those who are getting the basic necessities, but not all are getting them. There are those people who are in critical conditions. There are those who are expectant, that need to be given certain medication. There are those, I believe there are ladies here who need access to items like sanitary towels. There are some of us that need items like just basic toothpaste, soap. There are some of us who actually don't even have access to that meal a day. So we are asking that these items can actually be provided, that they can actually provide just the basic needs to actually give us the peace of mind that even as we worry about the infections and what's going on around us, at least we have the basics that can actually give us some peace of mind.
Thank you, Jeffrey, for being so brave to speak to us tonight. Dr. Muthoka, you have heard that. And I want to read a tweet, Dr. Muthoka. Someone says they agree with what the two doctors on the show have had to say, but they ask, why then allow other nationalities to fly in via different hubs and then put them in quarantine? Should the policy not apply across board? Dr. Muthoka, what's your response to that?
That is true, and actually, those Kenyans who are returning back from their business trips or their students who have been studying in Wuhan, and they are coming back on their own because their term has expired, we are actually screening them, and we find them, they have any signs and symptoms, we are isolating them and taking care of them for 14 days. The difference is when we talk about evacuations of a number of Kenyans who are there and bringing them to Kenya. That decision is what Kenya has not made yet, and I believe
is it being discussed? Is it a possibility? What can you tell us?
It's been discussed at the task force level, which advises the government, and as my colleague has said, until structures to take care of these Kenyans who are going to be evacuated up neatly in place, it may not happen very soon.
One last
the needs of which our colleagues and our Kenyans who are in China have spelled out, I believe the Kenyan embassy in China should be able to take care of those needs so that they are comfortable as they wait for the time when the government will make a decision to evacuate them.
I hope that's something that you also follow up. One last question to you, a short one, this one. Somebody then asked, if the symptoms take time to manifest, is it possible that someone might pass through your screening at JKIA just before the symptoms, manifest, and then are you able to trace them? Do you take the number, a phone number? Do you have the address of everyone who's come from a coronavirus sort of prone area?
Exactly. For all travelers who are passing through the Jomo Kenyatta International Airport, before on the plane, they fill the travelers' health declaration forms, and we keep all those forms, and we also keep the conduct of where they are going, and we give them advice of what to watch out for the next 14 days.
Okay.
And for those who we suspect may develop the same symptoms, we have healthcare workers who call them on a daily basis from our Public Health Emergency Operations Center to find out if they're developing signs and symptoms, and we advise them on what to do.
Thank you. You've said 7 suspects at the moment, or 7 people with suspected symptoms, but no confirmations yet.
No confirmation.
Coronavirus in Kenya.
All of them had been tested negative to the coronavirus.
Okay, tested negative.
Released.
Dr. Mbajo, finish this up for us. I don't know whether you want to respond to what Jeffrey had to say, or Dr. Muthoka.
So I guess for Jeffrey, I hope Dr. Muthoka will help follow up so that at least people get the basic needs. I hope the embassy there will actually respond to those needs. Maybe just to follow up on some of the questions around what happens if someone comes in and then they don't have symptoms at the point of entry. So what we know so far is that the risk of spreading the virus when someone does not have symptoms seems to be low. So that's why we only quarantine those who have symptoms, because they are more likely to spread the virus. So at the airport, those who have symptoms will be brought to the Kenyatta National Hospital. We've already received quite a number of patients, as Dr. Muthoka said, all of whom have been confirmed negative for this coronavirus. For those who don't have symptoms, I think it depends on honesty. It depends on all of us. As we say in infection control, that we're as strong as the weakest link. So it's up to everyone to know that they're part of a chain, and if one part fails, then everybody fails. If someone has to give the correct information, has to be open to come in for care if they get symptoms. So if someone has gone home and they get symptoms, they can report to any of the hospitals. The Kenyatta National Hospital has the infectious disease unit where they can present, and they'll be taken care of and samples taken for testing. We are currently getting the results of this in a very short time. By about 48 hours, we have the results. And if those are negative, then we don't have to keep them in for 14 days.
We certainly hope, Daktari, that everyone will be honest. And if not, we must have the structures to ensure that even those who choose not to be can still be followed up on. Thank you so much for speaking to us. We've had Jeffrey Okundi, a Kenyan student studying in Wuhan, Hubei province. He says it's another quiet night for him, going on to now about 3 a.m., trying to figure out what to do in week 5 of the lockdown. Thank you, Jeffrey, for speaking to us. Please stay safe, and to all the Kenyans out there as well. We'll continue to air and highlight their stories as much as we can. Dr. Philip Muthoka is a member of the Coronavirus Task Force and a coordinator with the Ministry of Health, the Respiratory Pathogen Surveillance, and of course, Dr. Lois Mbajo, infectious disease specialist and a senior lecturer at the University of Nairobi. To each of you, thank you.